Welcome back to Tuesday's Loose Women. Now, today, Health Secretary Jeremy Hunt is to announce that trainee nurses who want NHS funding for their degree will first have to work for a year as a healthcare assistant or support worker. The new measures come in response to the recent NHS scandals regarding patient hospital care, and it's been reported that ministers believe placing student nurses on wards as healthcare assistants will help them develop the caring skills required. Any would-be nurse who refuses to take on such hands-on work will be denied essential NHS funding for their degree. But are these new training initiatives in danger of demonising our nurses?
I don't think it's going to demonise nurses at all. In fact, I'm shocked that that isn't part of the job anyway. I'm surprised that nurses aren't taught to take care of patients first and foremost. I would have thought that was the main thing that the nursing staff were there for. So I'm quite amazed that that isn't taking place. There's a very grey area in the NHS right now. So I think if we come in now and start as you mean to go on, then eventually you'll gain respect if you've done all that training to get to the top. And it is a career and it is a vocation. And I must say a lot of our nurses are amazing and they do an amazing job. Which they do. But there has to be a training scheme where people know, because it does seem to be that there's a lot of nurses out there that aren't caring. You know, whether it's in care homes or whatever. This should be vital. This should be part of the main part of the job for me. That's personally what I think anyway.
Although I think it's a good idea. I think that people who are deciding upon a nursing profession will already know what to expect, won't they? Well, that's what I think. And I think it could present a further obstacle to people deciding upon going into nursing because, you know, it's a very long course already. And one would think as part of the degree course, there is the nature of care and what that means and the practical tasks involved in that. So I think...
But the standards have definitely dropped.
Possibly, yes, but I think maybe it needs to go from two sides. It needs to start from the trainees, right, and then go back to the shop floor. The people in admin come back to the shop floor and go back to nursing and the essence of what nursing is.
But the problem is in the National Health now, it's split into many layers which don't really mesh together. The vast amount of money in the National Health Service is spent on administration, on people who sit in offices, who are pen pushers, who are completely disconnected with the frontline services. And I think that a lot of the shortcomings that have been unveiled in Staffordshire were at quite a high level of nursing. So they were quite a few senior nurses, and I heard it said on the radio this morning, created around them a climate which kind of didn't care. So it wasn't just nurses low down, it was quite senior nursing staff that allowed this to go on and even encouraged it. So I think that caring is a vocation, but I agree with Jane completely that I think it should be part of the course, and I welcome this. And I saw it firsthand when I made a TV series where I worked as a nursing assistant. You have got within the wards the nurses who have got degrees, which, you know, the government has elevated nursing to something rightly that ends with a degree, but you've also got this frontline staff doing all the very unpleasant jobs like feeding, mopping, cleaning, and they're on very, very low salaries. And I think it's right that nurses start their career at that level to understand that that is an essential part of nursing.
Obviously, we said at the start of the show to please get in touch if you're training to be a nurse, you're already working as a nurse. So thank you so much to those of you who get in touch. We've had a big response to this. Marissa has been in touch and said, as student nurses, we are working so hard anyway. We do healthcare role day in, day out as a student. Any good nurse, student or not, should be doing the same. Jane has got in touch and said, I'm a nurse and it worries me that there could be a year's compulsory extra training for student nurses. How will they be expected to survive financially for that long? And that's something that I must have been flagged up with me, because initially you think, absolutely, of course, it goes without saying that this should be part of the training. But as a member of my family, one of my cousins retrained as a nurse after, you know, she'd had her family and her children were just starting to get a little bit older. And they managed to survive with her obviously stopping the job that she was doing putting herself back through college and juggling family life. If you added another year onto that course, perhaps there is a chance that you could be losing out on people with life experience, not just the enthusiasm and skills that you need to be a nurse, but life experience of being a mother and a carer in that way, coming into the profession because you've stuck another year on it.
I do think that this extra year just presents another obstacle because, you know, if you're going to do this job, you should know already what that expects. And the student nurses have said themselves, they're already doing care. They're already doing the essence of care. Why would you be a nurse why would you decide on that career if you didn't know what to expect?
So why have we got patients who've got no water? Why have we got patients who haven't been washed? Why have we got patients who aren't being fed?
I think the headlines are very, very misleading, and already I think that young nurses are demonised.
Well, the facts are there.
I mean, the front cover of the Daily Mail, too posh to wash. You know, are you too posh to wash? You know, it's very, very misleading. There's a lot of young nurses out there who are working extremely hard. There's only one bad egg. And if you think about what you just said, Janet, you said it happens on the different tier, that the duty of care should also come from the admin people, the people who have more qualifications. They should go back to the floor and do that year with those student nurses.
Or do you think removing targets is a way to because you know, you're talking about managerial level of nurses who are more concerned with paperwork and filing things on their computer and reaching targets and basically neglecting the basic duty of care that most nursing professions.
That's how the job's been redefined. At a high level of nursing now, it's all about admin, targets and filling in loads and loads of forms online. And I saw that when I worked in Barnsley Hospital in the labour ward. They have to fill in this stuff every day, and that is time, and you know, a dedicated member of the team every day is inputting stuff into the system, and that's time when they could be dealing with patients. But that's the way we've redefined nursing.
Do you think to pick up on something you said earlier as well about the fact that the government has changed the qualification of nursing to become on par with a degree? You come out with a degree. Do you think people are choosing it as a career course rather than a caring profession because then they're just seeing it as a managerial role rather than a caring role?
I don't think so. I think there are people. I think it's very. You don't meet many people who want to go into nursing, and that's what I fear about this. That it will prevent more people wanting to decide upon a very difficult and very hard-working career.
Surely they've got to learn. Surely you've
They
got
learn
to.
that. They're
You've
doing
got
this
to learn how to
already.
care for someone and give somebody a glass of water
Jane, they're
or
doing
a meal.
that already.
Well, you'd think so, but there's obviously a big standard job.
Well, we,
you know, and you,
just to answer both of you, actually, we've had an email in that says from Margaret. It says, "I've been a nurse for 35 years, and I agree that students should first work as healthcare assistants. These days, some student nurses think they shouldn't be making beds or washing patients. They're there to learn and not be a nurse's helper." And this is, you know, it's all very well us speculating. This is from a nurse with 35 years' experience. So, you know, headlines or not, there is obviously a problem there. So hopefully, this is going some way towards redressing it, because it's not just the nursing profession. You hear the same thing time and time again in teaching, in the policing, in the policing profession. It's just about basic standards of care. That's what it comes down to.
Yeah.
Okay.